Hi friends, good evening and welcome to my channel Mookambika Nursing. Friends, today we can see some questions from pediatric nursing, that is from renal system. We will see the question one by one. First question, a nurse is assigned to care for a child suspect to have glomerulonephritis. The nurse reviews the child record and note that which finding is associated with the diagnosis of glomerulonephritis. This is the question, and our option we can see. First option A, hypotension, option B, brown colored urine, option C, low specific gravity, option D, low blood urea nitrogen level. So this is the question and option. So here our child is suspect to have glomerulonephritis. Diagnosis is glomerulonephritis, and the nurse reviews the child record and note that which findings, that is doctors, which findings associated with the diagnosis of glomerulonephritis. Here nurses must know the signs and symptoms of this glomerulonephritis, then she can easily find out the diagnosis. Okay, so we will see what is glomerulonephritis and then we can see the signs and symptoms. So glomerulonephritis refers to a group of kidney disorders characterized by inflammatory injury in the glomerulus. This is the actual diagnosis of this glomerulonephritis. So it is an inflammatory injury in the glomerulus. It's a group of disorder characterized by inflammatory injury in the glomerulus, that is called glomerulonephritis. Most of this is caused by immunological reaction, and also this is caused by group A beta hemolytic streptococcal infection of pharynx and skin may also cause this glomerulonephritis, and is also an autoimmune disorder. Glomerulonephritis is an autoimmune disorder. Okay, autoimmune also there is a cause, and also we can see the signs and symptoms. Mainly the signs and symptoms include periorbital and facial edema, mostly in morning time. Okay, so periorbital or facial edema mostly in morning time, and also anorexia, decreased urine output, cloudy, smoky, brown colored urine. So here in our option, brown colored urine is there. So urine, what is the nature of urine? Cloudy, smoky and brown colored urine. So brown color urine we can call as hematuria, that is blood in the urine, and also pallor, irritability, lethargy, and in older children, there is a chance of headache, abdominal or flank pain, and dysuria. Dysuria means difficulty in urination, and also hypertension, and also proteinuria, and increase blood urea nitrogen, and increase creatinine level also increase. These are the signs and symptoms of this glomerulonephritis. Here we can, our option B, brown color urine is correct, and the remaining option hypertension. So here hypertension will come in case of glomerulonephritis and low specific gravity. Specific gravity of urine will be high, and also low blood urea nitrogen. In this case glomerulonephritis, that is increased blood urea nitrogen and increase creatinine level. So the option A, option C and option D is not correct in this case. Okay, so we saw the definition and its causative organism and its signs and symptoms. Some intervention we can see in this case glomerulonephritis. We can, as a nurse, we can monitor the patient vital signs, weight, intake and output, and also we have to note the characteristics of urine. Okay, there is a chance of proteinuria is there, and color of urine, cloudy, smoky, brown color urine. We have to monitor the characteristics of urine also, and we have to give, main important is we have to give high quality nutrient diet to the patient. That is, depending upon the stage we have to give regular diet as per the order. Okay, depending upon the stage of disease we have to give diet to the patient, regular diet but sodium restricted diet we have to give to the patient, and also moderate sodium and fluid restriction also prescribed if the child with hypertension and edema. And in case of this proteinuria and all, we have to restrict protein rich diet to the patient, and also high potassium diet also we have to restrict the patient during the time of oliguria. Okay, these are all some interventions. Next question, the second question. A nurse is performing an admission assessment on a 2-year-old child who has been diagnosed with nephrotic syndrome. The nurse understands that the most common characteristics associated with nephrotic syndrome is, this is the question and option A hypertension, option B generalized edema, option C increased urinary output, and option D frank bright red blood in the urine. This is the question and option. So in our question, a child is diagnosed with 2-year-old child is diagnosed with nephrotic syndrome, and the nurse understand that which among the following is one of the important characteristics features of nephrotic syndrome. So here nurse should understand that what are the signs and symptoms of this nephrotic syndrome, then she can or he can easily answer this question. Here we will see what is nephrotic syndrome, and then we can see the signs and symptoms. So here nephrotic syndrome is a kidney disorder characterized by massive proteinuria, hypoalbuminemia and edema. This is the definition of this nephrotic syndrome. So nephrotic syndrome is a kidney disorder characterized by massive proteinuria. So protein is lost in the urine, and also hypoalbuminemia or hypoproteinemia. So serum albumin level will be decreased, and also edema. Edema is one of the most common characteristics features of this nephrotic syndrome. This is the classical manifestation of nephrotic syndrome. The classical manifestation of nephrotic syndrome is proteinuria, hypoalbuminemia and edema. In our question, generalized edema is there. So we can guess that option B will be correct over here. So we will see the signs and symptoms, then we can confirm the option. Okay, we will see the signs and symptoms. It is child gain weight in case of nephrotic syndrome, and periorbital and facial edema especially in morning time, and also leg, ankle, labial in case of female child labial, or in case of male child there is a scrotal edema will be there, and also urine output is decreased. So urine output is decreased in case of nephrotic syndrome, and the nature of urine is dark and frothy urine, and also ascites maybe occurs, and blood pressure usually it is normal or slightly decreased in case of nephrotic syndrome, and the child will be have lethargy, anorexia and pallor, and massive proteinuria, and decreased serum protein and elevated serum lipids level. These are all the main signs and symptoms of this proteinuria. So in our question, generalized edema, option B generalized edema is the correct answer over here, and the remaining option hypertension, there is no chance of hypertension. Why? There is a manifestation itself it told there is BP will be normal or slightly decreased, and option C increased urine output. So here urine output will be decreased not increased, and frank bright red blood in the urine, it is not correct. The urine will be dark and frothy in nature, so that is also not correct. So here option B generalized edema is correct over here in case of nephrotic syndrome. And we can see some interventions in this case of nurse. We can see some intervention in case of this nephrotic syndrome, that is we have to monitor the vital signs, in-day count, output chart, and also daily weight. So weight gain is one of the manifestation of this, so daily weight we have to monitor, and the specific gravity of urine and protein, okay, we have to monitor. And for edema we have to monitor the edema, and also nutrition is one of the most important aspect, that is regular diet without added salt we can advise to the patient, and also sodium restricted during the time of edema, and also fluid restriction in time of edema, that also we can advise to the patient and mother. And also we have to give as per doctor's order medication, corticosteroid, Diuretics also we can administer with doctor's order, and also the main most important things is we have to assess for signs of infection, and we have to advise the mother not to contact with other infectious child. This is one of the important nursing aspect in case of nephrotic syndrome. Next question, the third question, a topical corticosteroid is prescribed by a physician for a child with atopic dermatitis, eczema. The nurse instructs the mother in how to apply the cream and tell the mother to. This is the question, and Option A, apply the cream over the entire body. Option B, apply thick layer of the cream into the affected area only. And option C, avoid cleaning the area before application of the cream. And option D, apply thin layer of cream and rub into the area thoroughly. This is the question. So here the diagnosis of child is atopic dermatitis, and doctor prescribed topical corticosteroid. So the nurse instruct the parents how to use the cream for the child. This is the question, and our options we already saw. So we will see what is atopic dermatitis. So then we can answer the question easily. So atopic dermatitis is a superficial inflammatory disease primarily involving the epidermis. So it is a superficial inflammatory process mainly affecting the epidermis, that is called atopic dermatitis. Here topical corticosteroid is prescribed by the doctor, so it should be applied a thin layer and rubbed into the area thoroughly. So the medication topical steroid should be applied in a thin layer and is rubbed into the area thoroughly. So our answer option D, apply a thin layer of cream and rub into the area thoroughly. That is correct over here. And the remaining option we can see. Before that we will see the affected area should be cleaned gently before the application. So we should clean the area, that is the dermis area, we should clean thoroughly before applying this medication. And also the steroid should not be applied on the entire body. The affected area should be used the cream. So option B is not correct. Apply the cream over the entire body. We should not apply the entire body. And a thick layer of the cream is affected the area. Option B is also not correct. That is thin layer we are applying the cream. And option C, avoid cleansing the area before application of cream. So this is also not correct. Why? That we should clean the area before applying the cream. Okay. So here our option, apply thin layer of cream and rub it into the area thoroughly. Option D is correct over here. Okay. We will see the next question, the fourth question. A nurse is caring for an infant with diagnosis of bladder atrophy. To protect the exposed bladder tissue, the nurse planned to. This is the question, and option are, first option, cover the bladder with petroleum jelly gauze, and second option B, cover the bladder with a non-adhering plastic wrap, and option C, apply sterile distilled water dressing over the bladder mucosa, and option D, keep the bladder tissue dry by covering it with dry sterile gauze. This is the question and option. So here the infant is diagnosed with bladder atrophy. So we have to know what is bladder atrophy. And as a nurse, to protect the exposed bladder, what is the plan of action? That is the question. So here we will see what is bladder atrophy. So bladder atrophy is a congenital anomaly characterized by extrusion of urinary bladder to the outside of the body through a defect in the lower abdominal wall. This is the bladder atrophy. So bladder atrophy is a congenital anomaly characterized by the urinary bladder is protruding out through the weak abdominal wall. That is called bladder atrophy. So while caring this bladder atrophy infant, the nurses should understand that she should cover the area, that is the bladder, the area. She should protect the exposed bladder tissue from drying. This is the important action, that is she should protect the exposed bladder tissue from drying while allowing the drainage of urine. So the urine should be go, and she should expose the bladder tissue from drying also. So for that, what she should do is, this is accomplished best by covering the bladder with non-adhering plastic wrap. So our option B is correct over here. Cover the bladder with a non-adhering plastic wrap. We should not adhere, we should not attach it by plastic, we should use non-adhering plastic wrap, and also we should prevent the area by drying. Okay, and the remaining option we can see, cover the bladder with petroleum jelly. We should not use petroleum jelly because it will be easily dry out. So we will always keep the area we should prevent the area by drying. So we are using petroleum jelly means the dressing will be easily dry out, and the mucosa and the drainage tissue will be removed. Delicate tissue, the bladder is very delicate, the tissue will be removed. So we should not use this petroleum jelly. And the other option, apply sterile dressing water, sterile distilled water dressing over the bladder mucosa. This also, thus we are using the sterile distilled water also, the bladder area will be easily dry out. So we should not use that. And also keep the bladder tissue dry by covering with sterile gauze. We should not dry the area, always we should prevent it from the drying. Okay, so then only easily drainage of urine will come out. So our option B is correct over here. Cover the bladder with a non-adhering plastic wrap. Next question, the fifth question. A nurse is performing an assessment on a child admitted to the hospital with a probable diagnosis of nephrotic syndrome. What assessment finding would the nurse expect to observe? This is the question and option. Option A, weight loss. Option B, decreased serum lipid. Option C, proteinuria. Option D, all of this. This is the question. As we already saw what is nephrotic syndrome, what are all the signs and symptoms of nephrotic syndrome. In the second question we already saw. So here a child is admitted with the diagnosis of nephrotic syndrome. So what assessment finding would the nurse expect to observe? This is the question. So here we will once again we will see the definition of this nephrotic syndrome. Nephrotic syndrome is a kidney disorder characterized by massive proteinuria, hypoalbuminemia and edema. The definition itself, it is there, proteinuria. Okay, so nephrotic syndrome is a kidney disorder characterized by massive proteinuria, hypoalbuminemia and edema. Okay, so we can expect option C is correct over here. The classical manifestation nephrotic syndrome is massive proteinuria, hypoalbuminemia and edema. And other symptoms we can see weight gain, child weight gain, periorbital and facial edema, most prominent in case of time of morning, and leg, ankle, labial or scrotal edema. Urine output is decreased, urine is dark and frothy, and there is a chance of ascites, and blood pressure will be normal or slightly decreased, lethargy, anorexia and pallor, and massive proteinuria, and decreased serum protein, and elevated serum lipid level. Okay, elevated serum lipid level. Here weight loss, weight gain will become, and serum lipid will be elevated, and proteinuria. Proteinuria is the most common classical symptoms of this nephrotic syndrome is proteinuria, hypoalbuminemia and edema. So option C is correct over here, proteinuria. Remaining its manifestation and intervention, everything we saw in second question. Okay, this is the questions today. Thank you.